carcinomas, cervical carcinomas, and on osteoporosis. It's also important to get regular blood pressure checks, cholesterol screenings, and diabetes screenings to monitor overall health. Along with this, the female should be advised that whatever she sees in her life and a different occurring in the body, she has not to ignore that. If she has some problems with the bleeding, if she has some other problem, she has not to, she has to be told about that you have to feel if you have any lump in the breast or something like that, if you have a bleeding after postmenopausal, any bleeding is there. So she has to take care of those things. Now, they have mental health and emotional well-being has also been taken in account, and there has to be a strong support system, and it's essential to recognize and express emotions in healthy ways. Then repressing emotions, it can lead to increased stress, anxiety, and physical health issues. Then what are the role of emotions in the health? Mindfulness and self-compassion. These are the valuable tools for managing emotions. For managing emotions, we have to be mindfulness and self-compassion. Then what do we feel, what do we mean by mindfulness? Mindfulness, जैसे हम स्कूल में होते थे तो हाँ क्लास चल रही है, टीचर हमको पढ़ा रही है और हम कहाँ हैं? हम प्लेग्राउंड में हैं. वी आर थिंकिंग ऑफ द प्लेग्राउंड कि आज हम कौन सा गेम खेलने वाले हैं क्लास के बाहर. So mindfulness, it involves being present in the moment and observing thoughts and feelings without judgment. And self-compassion, this involves treating oneself with kindness, understanding and acceptance. तो जो सब कुछ बुरा हुआ वो मैंने नहीं किया है, ये नहीं सोचना है. मैं यही सोचती हूँ कि we have to be involve self-compassion. Then we have to practice the mindfulness and self-compassion to be holistic. Then mindfulness, they are the valuable tools for managing emotions, and they involve being present in the moment and observing thought and feelings without judgment. And the self-compassion, it involves treating oneself with kindness, understanding and acceptance. So these are few things which we have to keep in mind, and we have to ask the ladies to practice it. Then the spiritual health, that is how we have to nurture our inner self. This spiritual health, it involves connecting with one's inner self and finding meaning and purpose in life. क्या बस खाना पीना ही हमारा पर्पस है जिंदगी में आने का? कोई बताएगा क्या? कोई बताएगा क्या कि बस खाया पिया मस्ती करी and that's all, finished? या हमने बच्चों को बड़ा कर दिया, बस हमारा काम खत्म हो गया? मेरी एज ग्रुप पे, बच्चों की एज ग्रुप पे, स्टूडेंट्स की एज ग्रुप पे पढ़ लिया, पास हो गए, बस काम खत्म. इतना ही काफ़ी है क्या? नहीं. We have to be spiritually healthy And this involves connecting with one's inner self and finding meaning and purpose in life. So make your purpose in the life why we are here and do something for your life. So this can be achieved through practices such as meditation, prayer, and spending time in nature. The nurturing spiritual health can lead to increased resilience, inner peace, and sense of connection with oneself and others. What are the benefits of meditation? It's a powerful practice that can promote spiritual well-being. Sometimes हम लोग को we feel कि भाई हम बहुत exhaust हो गए हैं और अब हम काम नहीं कर सकते, ऐसा होता है. तो हमको अगर हम डेली लाइफ में अगर हम प्रैक्टिस करते हैं मेडिटेशन, तो शायद हम ये फील ना करें, क्योंकि एवरी डे जो हमारा बर्डन आता है वो हमने स्पिरिचुअल मेडिटेट करा और हमने वो बर्डन अपना निकाल दिया. सो दिस इन्वॉल्व्स focusing the mind and cultivating mindfulness and awareness. So regular meditation practice, this can reduce the stress, it can improve the concentration and enhance emotional regulation. हमारे इमोशंस पे हमें गुस्सा आ रहा है, तो हम अगर स्पिरिचुअल हैं तो हमें कम गुस्सा आएगा. ज़्यादा गुस्सा दूसरे को परेशान करेगा या हमको परेशान करेगा? Yes, who will tell? बच्चों में से, स्टूडेंट्स में से कौन बताएगा कि हम गुस्सा करेंगे तो किसका नुकसान ज़्यादा है, सामने वाले का या अपना? कौन बताएगा? यस, बताएं. माइक पे बताओ.
मैम पहले तो जब हम गुस्सा करेंगे तो न्यूरॉन्स पे इफेक्ट पड़ता है उसका डायरेक्टली. रिग्रेट भी होएगा, फिर थोड़ी गुस्सा शांत हो जाएगा कि क्या बोल दिया,
क्यों बोल दिया, क्या बोल दिया, दूसरा भी परेशान हो गया और फालतू में फिर लगेगा अब मैं उसको मनाऊं या क्या करूं,
यस मैम,
कैसे समझाऊं, किसी के थ्रू कहलवाऊं, सो मेनी थिंग्स. तो आपको गुस्सा जो है, अगर आप थोड़ा स्पिरिचुअल हैं तो गुस्सा कम आएगा. ओके, थैंक यू वेरी मच अनवी.
थैंक यू.
So this is the one. So regular meditation practices, they will reduce the stress, they will improve the concentration and enhance the emotional regulation too. Then जब हमें गुस्सा आया तो हमें क्या हुआ? हमें लगा कि भाई हमने ये क्या कर डाला, जो अभी उसने बताया. And we have to forgive. So gratitude and forgiveness, they are the essential components of spiritual health. And the gratitude, it involves acknowledging and appreciating the good things in life, while forgiveness involves letting go of resentment and anger. Then practicing gratitude and forgiveness, this can lead to increased happiness, improved relationship, and a deeper sense of spiritual connection. Now, this comes to social health, how we have to nurture our relationships. If we are sitting alone, we'll feel what we have to do, and there is nothing to do. Either I'll see a book or I'll see a film or do anything. But strong social connections, they are essential for mental and emotional well-being. Nurturing positive relationships with friends, family members, and romantic partners, it can also provide support, comfort, and sense of belonging. Then this is important. We can build and maintain a healthy relationship. This involves effective communication, mutual respect, and empathy. Then finding a balance between socializing and solitude. ऐसा नहीं कि सारे टाइम हम 24 घंटा में से 10 घंटा माइनस कर दीजिए सोने के, बाकी टाइम हम सोशलाइज ही कर रहे हैं, तो दैट डजंट वर्क. हमें क्या करना है? वी हैव टू फाइंड अ बैलेंस बिटवीन सोशलाइजिंग एंड सॉलिट्यूड इज इम्पॉर्टेंट फॉर सोशल हेल्थ. While socializing, it's essential for building the connections and maintaining relationships. Solitude allows for self-reflection, relaxation, and personal growth. So, solitude is also very important. It's important to listen to one's needs and set boundaries around social interactions. वी हैव, ये नहीं है कि आज हमने स्पोर्ट्स में चले गए, आज हमने बहुत सारा काम कर लिया और अब हम थक हार के सो गए, अब हम ऐसे ही पड़े रहेंगे. नहीं, वी हैव टू बैलेंस, टू मेक अ बैलेंस बिटवीन देम. सो देन देयर इज़ द रोल ऑफ कम्युनिटी इन द हेल्थ. अ सेंस ऑफ कम्युनिटी एंड बिलोंगिंग is a crucial for overall health and well-being. Being part of a community, it provides support, social connections, and a sense of purpose. While community involvement, whether through the volunteer work, social groups, or cultural activities, they can enhance social health and overall quality of the life. Then there is a newer chapter being added to in today's life is about the herbal health, which we followed maybe years ago or 50 years ago. हम लोग के पास क्या होता था कि किसी के चोट लग गई, कोई बीटाडीन नहीं था, कोई स्पिरिट नहीं थी, कुछ नहीं था, तो माएँ क्या करती थी? उन्होंने घी में हल्दी गरम की, उसको कॉटन पे लगाया और बच्चे के चोट पे बांध दिया और उसको कपड़े से रैप कर दिया, उसको टाई कर दिया. सो दिस वाज हल्दी. अब किसी को भी नहीं पता था कि हल्दी में क्या है, बट सारी लेडीज़ ये काम करती थी. बच्चों की तो चोट लगनी है और उनको हल्दी बांधनी है. तो अब हमें पता चल रहा है कि भाई हर्बल जो ड्रग्स हैं, हर्ब्स जो हैं, दे हैव सो मेनी थिंग्स इम्पॉर्टेंट इन देम. सो लेडीज़ तो शुरू से ही इसको यूज़ करती आई हैं एंड नाउ देर इज़ रिसर्जेंस इन द हर्बल मेडिसिन. ये मेरा थोड़ा गड़बड़ पार्ट है जो कि मेरा चेंज कर देता है. So this medicine for women's health mainly due to demand from women themselves. अब लोग कहने लगे हैं, समझने लगे हैं कि जो एलोपैथिक दवाइयाँ बन रही हैं उनमें कुछ हार्मफुल साइड इफ़ेक्ट्स भी हो सकते हैं, तो क्यों ना हम अपनी हर्बल मेडिसिन पे ही चलें. So this is beneficial for any women's health and any age. And from teens to menopausal years, they are available today. So herbs, especially for women, they are the hormones which are being covered and they encourage the menstruation, they improve the circulation and tone of their reproductive organs. In addition to these, there are many herbs that work on all of the symptoms in the body to help create balance and the support of the health. Now there is a plant, cohosh. It is black cohosh, which has got many benefits for both the genders, for males also and for females also. But females are much benefited by this black cohosh, and this gives relief from anxiety, chronic anxiety and insomnia. It reduces the risk of blood clots that cause heart attacks. It is beneficial in providing relief from menopausal symptoms. It aids in managing painful labor contractions and menstrual cycles, and it strengthens uterine muscle and helps to prevent miscarriage in women, and helps to reduce flatulence, cramping, bloating, and morning sickness, and the nausea. So these are the herbal drugs which can be used by the women and by the men. And the conclusion is that for a woman, it is important to follow the balanced diet, the physical fitness, the economical part for which we are here, and there are healthy balanced diet. They have to do exercises, and they have to keep their body fit. So this completes my holistic health, and I think we will start doing something about spiritual health too, and the mental health too. So thank you very much once again
for sharing your insights and experience with us today. I request our respected chairpersons to kindly say a few words for our esteemed speaker who has just completed an amazing session.
This is a quote which was given by Harriet B. Stowe, and she says that a woman's health is her capital. Thank you very much.
Thank you very much. It was a wonderful paper presented, and it was in so much of details that she covered almost each and every aspect. And it is something wonderful to listen to you today, and it has given a very wide angle to understand woman practically, that how she is superior than men, and how she can do wonders in her life, and she can manage things, because the men cannot, as you very rightly said, that you are put into a disciplined cycle of life due to menstruation and all, and you can manage those things. You can understand things in advance and then plan for them so better, because men are not that way. They go hayway, and they can without any responsibilities, and the mother's love is the unconditional love.
Yashoda Maya.
Yashoda Maya and Anuradha ji been talking when she was explaining that this love for the whole humanity is something wonderful which is there in women, and I think taking care of their health, as you explained, it is something wonderful. I will be talking in my paper on spiritual health and emotional health, how to really understand yourself, so that all these problems what you explained can be covered in much deeper sense, how we can really manage and do things. I would request my other panelists to say something.
Good afternoon, ma'am. Being a female, I think it was a very important topic, and it was well covered by you, ma'am. And a very relevant topic for this conference, when we are talking about holistic health. And I also stress on that each and every female should focus on holistic health, as it leads to less stress, better relationships, and give more purpose to life, and give more feeling of fulfillment also. So each and every female should focus on holistic health, not only physical health, but also other aspect of health also. It was very well covered by you, ma'am. Very nice presentation. Thank you so much, ma'am.
Thank you, sir.
Madam, good afternoon. You are from Agra Asian Medical College. I am also nearer to you. I am from Safi. Madam, you are talking about women's health. Being a physiologist, we must think how to reach common people. If you are talking about regular physical exercise, we are in medical institution, we are standing here, you are presenting, and look at the audience. Very few are here. What I want to say is, there are many organizations, institutions, both academic, non-academic. I think physiologists have a big role to reach common people. I think physiologist is the only people who can explain the physiological mechanism which is operating in both male and female. So I think, being a physiologist, what's your opinion? How we can reach? We must think about how to go to a common people. जो मैंने बताया कि there are organizations where we can go, like community medicine people are going and collecting the abnormal patient. We also must go and must act such a way so that we can reach up to a common people. How we can tell them that this is the real fact.
Actually, reaching to the masses, very good option for, especially for the females, if we say, that can be done for both, for the boys and for the girls also, in colleges and schools. Actually,